Contractions. That's like the C word of birth, am I right? Women are freaked out by the thought of contractions, and rightly so. That really is the source of 99%, or okay, maybe like 95% of childbirth discomfort. We'll give the other 5% to pushing, even though personally I found pushing strangely much more comfortable than getting through contractions during active labor and transition. However, there were certain tools that I used during an unmedicated birth to make those contractions, the surges, much more manageable. These are also tools that I utilize with my doula clients to support them in moving through the surges. All right, so my first tip is counting to 30. So for the most part, surges peak at around 30 seconds and then start to subside and become less and less uncomfortable. This isn't a hard and fast rule, but generally that's about the time when it peaks. So counting to 30, not a fast count like 1, 2, 3, 5, gives your mind something really simple and super specific to focus on versus, oh my God, this hurts, I'm in pain, like all the freaking out that can overwhelm you and actually create more pain in your body. Because when your mind is screaming pain, your body responds with more pain. So shift out of that painful mindset by sticking to the most simple thing ever, counting from 1 to 30. Okay, number 2, it's so important to remember that each surge, each contraction brings you closer to your baby. So even if you get a vaginal exam and like, oh yeah, you're at 4 centimeters, and an hour later you're still at 4 centimeters, that doesn't mean that all of the contractions you had within that hour did nothing. They were probably helping you efface, meaning they were probably helping to thin out your cervix. They were probably helping your perineum open and unfold, helping your pelvic structure widen. There's so many other things happening in birth besides just your cervix opening. And I'll bet your cervix made a little bit of progress during that hour. So it's, again, just really focusing on how amazing each contraction is, which I know sounds crazy because as each one comes on, you like prepare yourself for the worst, but it doesn't have to be the worst, and it can be seen as a gift because without those contractions, we're not having a vaginal birth. So it can be tricky in the beginning, but with practice, you can really learn to welcome those contractions. Okay. If you have to make a sound, that's totally fine, but make sure it's in a low register, like a moo like this, versus like, oh my God, those are so bad. Because when you get really high, you induce panic and it can be easier to hyperventilate when you're getting really high. So if you want to moan, if you want to curse, keep it really low. All right. 4, start your deep breathing right when you feel the surge coming on to get ahead of the pain. So when a surge is coming on, when a contraction is coming on, you start to feel an inkling, kind of like some menstrual cramps. That's when you should start doing that really deep, slow breathing that I talk about in the breathing techniques video on this channel. Essentially, you're just taking in that really slow inhalation through the nose, envisioning inflating a balloon in your stomach. When that balloon reaches full capacity, you slowly deflate that balloon by exhaling through your nose. So start doing that before the surge, before the contraction gets super intense. Sorry, I'll stop doing this. This is annoying. Okay, focus on surrendering to the surge. So this might be another kind of annoying tip. It's like surrender to the surge. Like, I don't want to surrender to it. I hate the surge. But when we resist the surge, the muscles in our uterus fight against one another, intensifying our pain. Our uterus is not able to surge and rise and push down the way it really needs to birth baby, we limit the effectiveness of our surges. We maximize our pain. We really just fight against ourselves when we don't surrender to the surge. So when you have that contraction coming on, just keep saying in your mind, like, I surrender to the surge, I surrender to the surge, I surrender to the surge, or I surrender to the contraction. And then follow up with that thought by doing a body scan and noticing if you're tense or tight anywhere in your body. And of course, your abdomen is naturally going to rise and harden, so that part doesn't count. But like if your face is tense or your fists are balled up or you're curling your toes, really work to relax every part of your body and fully surrender. Okay. Speaking of your mouth, have somebody gently massage your mouth. Oh my God, it feels so good. Your mouth and your jaw as you're having a contraction, because it can be really easy to clench your jaw when you're having a contraction. And our mouth, our jaw specifically, is directly connected to the vagina, to the cervix, to the perineum. So when our jaw is tight, it's more likely that our perineum, our cervix, is going to be tight and taut and harder to fit a head out of. So massage the jaw, just allow all that tension to melt away, and it's going to allow the perineum, the cervix to open, and it's going to allow everything to work better, and it's going to make your labor hopefully go faster. Okay, receiving lower back pressure. So even if you're not having back labor, which, side note, is more common if you have a sunny side up baby, your surges, your contractions, the sensations are likely going to wrap around to your back, and you're probably going to have a somewhat sore back. So receiving pressure, like go to the bottom of your spine and have somebody press in to that lower back area. There's also pressure points down there. So if somebody takes their finger, goes to the bottom of your spine, on either side of your spine, about an inch, inch and a half, 2 inches, there should be 2 depressions, and have them press into that area, maybe massage it a little bit or just do a firm pressure, and that's going to create a lot of relief. If you really, really want deep pressure in your lower back, bring a tennis ball or 2 tennis balls to your labor, so somebody can press a tennis ball into your lower back or a tennis ball into each pressure point at the bottom of your spine. On each side, not actually on your spine. Okay, sniffing a tissue with lavender oil, as this signals to your mind and your body to immediately relax. If you don't like lavender, choose another soothing scent, but aromatherapy is real, it works. It seriously supported me during my own birth experience, and I always have like a tissue with a few drops of lavender oil for every woman that I support during birth, plus an essential oil diffuser. So what you do is you have that tissue with the few drops of lavender, and just like you start breathing as you feel the contraction coming on, you take a big whiff of that lavender to just set the tone for the contraction. Surrender, release. Don't feel like you have to respond to anyone who tries to talk to you while you're having a contraction. Sometimes, to be fair, people can't really tell when you're having a contraction or not, especially if you have your eyes closed and you're not making much sound. But sometimes they do know, and they still talk to you anyways, which can be really irritating. You have every right to stay silent and not respond to anybody when you're focused on getting through a contraction. And then when you're done, you can tell people, you know, if possible, please don't ask me anything or tell me anything when I'm having a contraction, because I almost guarantee I'm not listening to you. I'm focusing on getting through a contraction. So make them hold their questions. And same thing with a vaginal exam. You do not have to let somebody give you a vaginal exam when you are having a contraction, because that hurts like hell. Okay, finally, number 10, if in doubt, move to the toilet, as it tells your body to open and release, which makes contractions easier. And you might not realize that you are holding in poop potentially or urine, and that increases the intensity, the pain of a contraction. So sitting on the toilet allows your body to release, to empty your bladder, empty your bowels, and hopefully help baby make some serious progress down and out. If you can think of any other tips that helped you get through contractions during childbirth, please help us all out by leaving your suggestions in the comments below.